Let's talk about a topic a lot of us would rather avoid: erectile dysfunction, or ED. It's more common than you might think. In fact, over half of men between 40 and 70 experience some degree of it. You're definitely not alone. So, what actually causes ED? It's not just in your head. There are physical reasons like blood vessel problems, hormones, and even nerve issues. If you have high blood pressure, diabetes, or high cholesterol, those same things that hurt your heart can also affect your performance. Even something as simple as riding a bike with a narrow saddle too often can be a risk factor. Hormones matter too, especially testosterone. Low testosterone can mean lower desire, trouble with arousal, and even weaker orgasms. And here's a key point: if your ED pill isn't working, it's not always the pill's fault. Sometimes, it's about how you're taking it, or if your testosterone is low. Some studies show that treating low testosterone can actually make these pills work better. Now let's get down to the pills themselves. The most well-known is sildenafil, better known as Viagra. It works for almost 70% of men with ED, but there are others. Tadalafil, called Cialis, and Vardenafil, known as Levitra. They all help you get an erection by improving blood flow, if you're sexually stimulated, but they're a little different. For example, Levitra is more potent than Viagra, so you might need a lower dose. It's also a bit more targeted, which might mean fewer side effects. Cialis, on the other hand, lasts much longer in your system, up to 17.5 hours. That means you don't have to plan things down to the minute, but if you take nitrates for heart issues, Cialis might not be the safest option because it sticks around in your bloodstream for a long time. What about side effects? They're usually mild headaches, flushing, and sometimes back pain, especially with Cialis. For some people, Levitra might have fewer side effects, but everyone's different. And if you have diabetes, Levitra has shown good results in studies. Why do some men stop taking these pills? Sometimes it's side effects. Sometimes life changes. Maybe you're not in a relationship or you're worried about safety, but here's some reassurance. Sexual activity, even with these pills, only slightly increases your heart risk by about 0.1%. And if the pills don't work for you, there are other options like vacuum devices, injections, or even surgery. The most important thing is to work with your doctor. ED isn't just one thing, it's about your overall health. Get a full checkup, talk honestly, and don't give up after trying just one thing. Remember, you're not alone, and there are solutions out there. Don't be afraid to ask for help. Your quality of life matters.